Good morning. We're going to be doing upper lower lids today. One of my favorite surgeries because it really does a really good job of rejuvenating the lids and kind of refreshing without many people being able to tell. And with more advanced techniques, you can also get sort of like a mid-cheek lift from this, which I'll be able to demonstrate in this patient. This is the tear trough ligament and the orbicularis retaining ligament out laterally. And this is the ligament that's the transition between the lower lid and the cheek. And this is mainly what happens when gravity pulls down off of this ligament, our cheek volume, and then our lower lid, the fat, herniates out. It's not more fat, it's the same amount, it just sticks out. So this one is sitting in the perfect position for when I release this ligament, I'll be able to pass this beneath to fill this area to keep that ligament from sticking back down, and it stays preserved on its blood supply, which runs right through it. So you have 100% fat survival compared to fat grafting when you take fat from somewhere else, put it in, and half of it dies, sometimes a third of it. This 100% is going to survive. Exactly what we make on table ends up being what the end result is. It's a nice, elegant way of addressing the mid-face and the lower lid. So those are the marks. And we're also going to be doing CO2 laser, just the face and neck, which anytime you're going under anesthesia for anything for your face and you have the downtime and you have the right skin type, it is the perfect skin refresher. It turns back the clock 10 or 15 years. It's like polishing off the paint. I'm excited to show you what it looks like. All right, so we've taken the skin off of the upper lid, plus take a look at this other side, how there's a little soft tissue bulge right there, medially. That's actually a little fat pad, the nasal fat pad that I took out through a little small nick I made through this muscle and pulled it out. And that kind of takes some of that fullness out, but we don't hollow it out all the way. We want it to be flush. And now I'm gonna sew this part back and show you the skin resection on the other side. All right, so we've done the upper bleph, took a little bit of the fat pad out centrally. Now we're gonna do the lower bleph, and I already pre-injected this, and I'm gonna go in there, release the ligament, which is the extended transconjunctival bleph, isolate the fat, then transfer it below the ligament.